Okay, thank you so much. Good afternoon, ladies and gentlemen. I'm Harrison Kim from South Korea. This time my topic is advantages and rationale of uniportal full endoscopic transforaminal interbody fusion. It is my great pleasure and great honor to give a lecture in World Congress on spine endoscopy. Thank you so much, Dr. Marco. This is my disclosure and curriculum vitae. Yes, we already well known that endoscopic spine surgery, the generation is changed from the discectomy generation to stenosis without instability generation. It's meaning that now the generation is the decompression and fusion generation of the endoscopic spine surgery. This paper is my study during my 3 years of the each different generation of the discectomy generation and decompression generation and fusion generation. You can see here, if we can doing the discectomy generation, we can performing and you can manage near 75% of degenerative patients using the endoscope. But if we can possible during the decompression surgery, we can possibly manage the patient of degenerative spine patient disease near 80%, 90%. But if we can performing the fusion surgery, endoscopic fusion surgery, we can manage the degenerative spinal disease more than 95% of the patient. It meaning that we can really give the to the patient good clinical result and good treatment tools for the patient. Yes, nowadays the endoscopic unimental fusion surgery introduced 3 different techniques. It is well known that Dr. Malcolm already give a lecture of the transcampus approach, and another 2 approaches, transforaminal approach and posterolateral approach. Among them, I like the transforaminal approach because it has some advantage compared to the, yes, the transcampus approach also very nice approach, but compared to this approach, transforaminal approach has some advantage to sufficient decompression of foraminal area. It can make more restriction, more exposure of the disc space, can manage more easily and can make more chance of reduction and disc height restriction chance more higher. And also it has some less dorsal to ganglion damage chance because I like these procedures. This is procedures of resection of inferior process procedures, and this is a resection of the superior process resection procedures. And anyway, to performing the endoscopic procedures, there have some technical basis. Most important technical important basis will be the nerve protection guide wire. Already Dr. Kavi talking about that, ask about that. I'm also making my cage glide guy naming Harrison cage glide guy. Cage glider. You can see here the some protection of the bilateral traversing and ejecting the root and can performing the cage insertion safely to the target point like this with increasing the disc height together. And also there have some technical tips to take a good surgical result. In my clinical experience, I hope to recommend the 3 technical tips. One technical tip is adhesive disc drilling. This is very important to take restoration of the disc height and the releasing of the disc space. This is very important procedures. And the second procedure is the endoplate entry drilling procedures. If we making some this entry point is some more wider because this is not a space for fusion area, we can expand expansion of this kite more sufficiently and expose the target point more sufficiently. And third technical tips is end plate denudation technique. You can see here the denudation, not scratching, only denudation of the end plate. This is very important tips to preserve the end plate and make a sufficient more good fusion rate compared to the previous operation. Because of that, before time, we firstly tried the endoscopic lumbar fusion as a minimal invasive spinal surgery, and also we thinking that also have some advantage of the minimized option of treatment. But in my clinical experience, I have some, searching several advantages. First things, advantage will be the sufficient decompression in spite of the deepest point, like because we already performing the endoscopic decompression sufficiently in spite of deeper point like this. Because of that, you can see the 73-year male patient with a huge facet cyst like this, and with the instability, you can see here the safely resection of this deeper point facet cyst, and can also take a good clinical results using the endoscopic lumbar fusion. And the second advantage will be the lumbar interbody fusion. It means that higher chance of fusion rate and more low rate of substance rate. You can see in my clinical study, I found 4 stages of the lumbar interbody fusion stage, because this stage is not exposed before open surgery, because at that time we cannot see these procedures. But using the endoscopy lumbar interbody fusion, I searched this 4 stages. Stage 1 is end plate preserve stage. Stage 2, second is end plate opening stage. And stage 3 is bilateral sclerotic, this KG sclerosis, intra-KG sclerosis and bilateral vertebral sclerosis. And stage 4 is a fusion breaching stage. Fortunately, usually the open surgery fusion process, usually this process need more than 1 or 2 years, but endoscope in fusion surgery in my cases, usually this process is more rapid. For example, in this case, is 6 to 7 year old female patient with the severe osteoporosis. In spite of severe osteoporosis, you can see here the 6 months follow-up. You can take excellent fusion of the in spite of 2 lumbar fusion space with high this kind of sufficient restoration. And the third advantage will be the discrete restoration. This is very important advantage of the endoscopic fusion surgery. This technique and this result already published in Brain Science to my article. And you can see here, for example, like this cases before time, we believe that this is not easy to restore the discrete under the open surgery. But with the adhesive disc drilling technique, you can see this kite can restore sufficient. We hope to make sufficient restoration like this. This 13mm K also can insert, and also you can see we can make like this. Severe disc height substance cases also can make sufficient restoration using the endoscope adhesive drilling technique. And also because of that, next advantage will be the some related to the degenerative deformity correction, like Dr. Son already commented that. First things, we believe that in this, like this severe spondylolisthesis with more than grade 2 is not easy. In spite of the open surgery, it's not easy. But we also believe that the endoscopic spine surgery will be more difficult for these cases. But unfortunately, this is more easy because we can docking to the foraminal area and can drilling the disc space. Because of that, we can take a sufficient disc restoration and spondylolisthesis reduction is possible. Also, you can see like this spondylolisthesis reduction, like this. And next, because of that, the next advantage will be the corrective surgery is more benefit in the endoscopic spine surgery. This paper also already published in World Neurosurgery by me. You can see here the some correction of pre and post OP and 6 months later. You can see, I already mentioned that this my paper already published in Brain Science. Because of that, we can performing the endoscopic this adhesive disc releasing technique can possible. You can see here the some corrective effective give like these cases. You can see these cases before time. This is very difficult cases to correction because this severe adhesion area. But if we using the endoscopic and disc releasing technique, we can give the sufficient restoration of the disc height. Because of that, the corrective surgery is possible. You can see only on once the single segment correction, you can see this some degenerative corrective scoliosis patient corrected near completely, and 6 months follow-up also sustained very well. Because of that, like this multi-level degenerative scoliosis can possible correct using the endoscopic spine surgery. For example, some correct to here, to here, to here. Then we can make some correction like this, and 6 months follow-up can sustain well. Because of that, Dr. Son already commented that in the future we will doing the deformity surgery can possible. This is my final cases. This is patient is 87-year female patient. This patient hope is she wishes that she can lie down and sleep. She's hope is only lying down and sleep, and also have some pain and walking disturbance also severe. Anyway, you can see here the degenerative so severe kyphosis, but before time in need a big operation, a big incision. But unfortunately, this patient is a near 90-year, 87-year female patient because of surgery is not indicated to this patient. But if we can doing for this patient, for example, like this, this sleeve operation and this endoscopic fusion cage insertion and endoscopic PSO pedicle subtraction also can possible to this patient, and the percutaneous screening can apply, can possible. We can take like this result, and you can see here some correction for this patient, and also the degenerative kyphosis can possible correct for this patient in spite of very octogenarian generation, more severe old generation patient can possible. And also post-operative, the patient is very happy and working is very nice. Because of that, endoscopic lumbar interbody fusion firstly starting to the rationale of minimal invasive spine surgery, like some minimal skin incision and the early return. But unfortunately, that is not true rationale. The true rationale will be the first preserve the endoplate to decrease the substance rate and increase the fusion rate. And the second rationale will be the disc height restoration with the reduction of spondylolisthesis and correction of the focal deformity. In conclusion, endoscopic lumbar interbody fusion has the advantage of minimal invasive spine surgery. Yes, I agree. But rather, it has the advantage of reducing substance and increasing fusion rate through endoplate preservation. In addition, since disc height restoration can be effectively performed through adhesive disc drilling, it is a surgical method that can be effectively used for corrective surgery in the future. Thank you for your kind attention.